Milanie Klein introduction we had last Monday.
Yeah.
Today we will take up an important concept of Milanie Klein, the paranoid schizoid position. I have listed out some of the important concepts of Klein. First is the paranoid schizoid position. Second, the depressive position. Third, envy. Fourth, greed. Fifth, omnipotence. Sixth, internalization of a good, reliable, stable object. Seventh, defensive operations in the inner world, which is very important, but Klein does not put an emphasis on this. And eighth, early life fantasies, which involve engulfment, merging back, babies in the stomach, baby eating, and so on. So these are some of the very important elements of Klein's theory. We'll take them up one by one. Today we'll go into the most important of her ideas, the paranoid schizoid and the depressive position. Because in Kleinian therapy, the one of the core goals is to move the patient from paranoid schizoid position to a depressive position. So let us go into what the paranoid schizoid position is and the depressive position is. Klein says the initial interaction of the child is only with the breast. The child does not yet have the capability to conceptualize a person, to understand that the breast is a part of an individual called the mother. The child relates only to the breast, and this relation Klein terms as part-object relation. Whereas understanding that the mother is a person to whom the breast belongs is a full person relationship. Usually what we do is we take a part of the person and generalize it to cover the whole of his personality, which is continuation of part-object relationships in adult life. That somebody tells us he committed a mistake and we never ask him what are the good things he committed. We take that description, part description of a person and generalize it onto the whole personality. So we are still in the part-object relationship. Full object relationship would mean we would collect all the data about that person, give it a considered thought, and then arrive at an integrated assessment of the person, putting together the good, bad, ugly, everything of the person. That will be a full person relationship. Knowing the full person and relating to him, accepting all that is inside of him. That is a full person relationship. But usually we want only part-object relationships. We want the good part of the person and we don't want to accept the not good part of the person, which either we oppose, we criticize, we silence by domination, or we split off. So Klein says, initially the child has part-object relationship with the breast. The breast to the child is not what it is to the adult. The breast to the child is everything. All the goodness of the world is inside the breast. Nourishment, survival, belonging, love, attachment, safety. It is omnipotent, all powerful, all good, all knowledgeable, all caring, all safe. It's a good omnipotent object. The child feels it is in heaven when it has the good breast. And there are two important elements with that the child feels. Three actually. One is omnipotence. Second is the splendor of the dazzle. The omnipotent good breast looks like something dazzling, as though some light is golden light is coming out of it, and you are just dazzled by the splendor. The splendor is so celestial that you are just dazzled in awe of that splendor. So this dazzle of the splendor is one important element apart from omnipotence. And the third is the ecstasy of being with it, the ecstasy of relating to it, the ecstasy of being accepted by it. And what to talk of ecstasy when it admired by it. This we see even in adult life. The dazzle of the splendor and the ecstasy of relating, of even being present. And this is most conspicuously seen in dependent personality disorder. Secondly, histrionic, and third, narcissistic. That the dependent feels the dazzle of the splendor. The narcissistic object looks splendid, as though it's emitting the celestial golden rays out of it. And there is a dazzle of the splendor. And there is an ecstasy of association. There is ecstasy of just being accepted by that omnipotent object, by the omnipotent object allowing you to be in its presence, accepting you. And if the omnipotent object admires you, you straight away go to the ninth heaven. You are at least on cloud 9, if at least on cloud 7, if not cloud 9. So these are the very important feelings the child feels. Now, what does it mean to be with the omnipotent all good breast? What it means is that the mother is emotionally, physically present and is able to give adequate amount of milk, and is also able to give adequate amount of positive emotions. All this goes into when we say the child is able to be with the omnipotent good breast. Suppose the mother is absent occasionally, then the child is not able to be with the omnipotent good breast for a considerable period of time. Let us say second situation, the mother is present, but emotionally she is not very forthcoming, positively speaking. Then again, the child is partly with the all good breast, but not completely with it. Third situation, for whatever reason, the mother is not able to give adequate milk. It happens often that because of some tragedy in the mother's life, suddenly the milk reduces or at least almost stops. I know of many situations where the mother's family member died, father, mother, brother, somebody. So the mother had a child, she was nursing the child, and within 2 to 3 months, somebody in the family died. The mother was so traumatized that she stopped producing milk. And then the child was in a situation that the mother was depressed. She could not produce milk. And the breast was available, but the milk was not forthcoming. The physical presence was there, but the emotional presence was not there. And the nourishment was not there. This led to the formation of dependent personality disorder. One more example I can give. A patient that I was seeing, while we were talking about object loss, suddenly had this visual. He said, I had a visual of a donkey's mother and a small donkey child. And the donkey child was trying to suckle the breast, but somehow it was just not happening. So he was remembering his own situation. And he also had dependent personality disorder. So he substituted with donkey because that is how he felt he was treated in childhood. And this was also a way of expressing anger towards the mother. So apart from defensive substitution, the substitution also communicated a message. It was not innocent substitution. It was substitution with a message of his own ill treatment and how he felt angry towards the mother. In some,
Sorry, sir. What do we mean by he was treated like a donkey, and
yeah, that is how
how partial presence only leads to dependent personality disorder?
the mother was physically present,
Yes.
but somehow the milk was not coming out.
Yes.
And therefore, the child experiences a kind of perceived abandonment. That he has been abandoned by the breast in some way. Because the child at that age is not able to differentiate between the good breast, the bad breast, and the real breast. So what the child feels is, if the milk is not coming out, it means the good breast is not there, a bad breast has come in its place. So he can only think in terms of the continuum, good and bad. He cannot think of presence and absence. He cannot think of the processing difficulties of the breast. So he can think in only simple terms of good and bad. That once upon a time I had a good breast, I don't know where it has gone. Now a bad breast has come in its place. And because the object constancy is also not established, one can even think if the good breast has abandoned me and went away forever, and now I'm settled with this bad breast. And then one can start thinking of I am not good enough and therefore I have been abandoned. And one can also think about maybe I did not please them enough and therefore they left me. So in future I will please everybody so nobody leaves me. So the core of dependent personality disorder, the core templates will be formed in early life loss. There can be a loss of full mother or there can be a loss of part object. That the mother is present but the good breast is no longer. That is a part object abandonment. That the physically the full mother is there but the good breast is no longer there. Or you can have a full abandonment that the mother herself is not seen.
And why donkey?
Huh.
Why donkey?
That was his way of expressing his anger by calling the parents donkey. And also a way of expressing the way he was treated like an animal. So early life loss can be of many ways. One, the mother herself is completely absent. Two, mother is absent, but the breast may give milk, but it may not give emotional nourishment. Or third, the breast may neither give emotional nourishment nor give milk. So you can have an absent mother, you can have a depressed mother, sad mother, or you can have a dead mother. The mother is so deeply depressed, it almost looks like dead. That it's almost like a dead body lying in front of you, and even if you try to shake her up, she's not shaken up. She's too depressed. So then what happens is, what you internalize in early life becomes different. You can internalize a bad object, you can internalize a sad mother, or you can internalize a dead mother. And to get out of deadness, usually you use the defense of reaction formation and you go into histrionicity. because histrionicity in a way is a defense of aliveness against deadness. Mania also is a defense of aliveness against deadness. So if you have internalized sadness, a sad mother, usually you will have hypomania, bipolar 2. But if you have internalized a dead mother, you will go into bipolar 1. And, or you may go into histrionicity. Because the histrionic is constantly running away from the deadness inside by trying to be alive and dramatic. So what happens there is, when the infant has a good enough breast, he feels he is in heaven. When the mother is not there or the breast is not given, he feels the good breast is absent. Not absent, but good breast is no longer present, is no longer existing. Instead of it, a bad breast has come into existence. Because there is no concept of presence, absence, or continuity in absence. The object constancy is still not understood. That even when something is not in front of my eyes, it is still existing. That object constancy is not understood.
I have a doubt here, sir. This is more like object permanence than constancy.
Yeah.
Object constancy would mean frustrating and gratifying breast is the same. They are the same person.
Right. That is more like integration.
I see. Mm-hmm.
That you integrate the good and the bad because you realize both are actually the same. The same thing I was seeing in two different ways, which is not true.
Yeah.
Actually, it is one. So the two images you have of the same thing, you put them together. It's integration. But it's like when the mother is not in front of me, I believe she's dead. Because I don't have the idea of object constancy beyond my perceptual field. So what is in my perceptual field is present. What is not in my perceptual field, I don't know if it exists or does not exist. So the idea of object constancy beyond my perceptual field is still not developed in the child. Slowly it will develop. That what is not in front of me can still exist. So when the good breast is not present, the child feels a bad breast is present. And now the child wants the good breast, but the bad breast is present. So child feels if I destroy this good breast, maybe the good breast will reappear. Or maybe the bad will convert into good. We don't know. So the child attacks the bad breast in fantasy. Of course, all of this is happening in fantasy. The child is not taking a cricket bat and going off after the breast. It's happening inside in the mind. The child attacks the bad breast with all its aggression, sadism, and brutality. And how sadistic and brutal he is based upon constitution.
This could apply to the interpretation of the war also.
Yes. Go on. How do you say it?
The breast became bad breast because it stopped giving the oil.
Correct.
So it needed to be attacked.
Correct.
And the omnipotence was threatened. And therefore the attack materialized because it was a living fantasy, not sleep fantasy.
Correct.
And then the destruction actually brought about the absence of death of the real breast also, because the team members, allies also prepared to separate and distance themselves.
Very well pointed out, because it's powered by greed.
And then the infant realizes that he's not all powerful, despite all the grandiosity inside.
The infant has a fantasy that if I can break apart the entire breast, I can have the good breast. I can have that oil
Yes.
and I can take over the reins of that kingdom where this breast side.
Oedipus also is overthrown actually.
Correct? Correct.
Mm.
It's like the breast dynamic and the Oedipal dynamic both are at play.
Yeah.
And if you look at the slide, point number 4 is greed.
Yeah.
It
Yeah.
is also at play. That
I
I
should
want to extract all the goodness from the good breast and make it mine.
I should squeeze it empty.
Correct.
Mm.
I should
And
extract, squeeze it empty. I should extract everything good that is there outside of me and make it mine. I will
yes.
do it. I will keep it with myself.
Mm.
I will not allow
And
anybody to have goodness outside of me.
yes. And the first fantasied omnipotence also there is nice ghazal. शफक धनुक मेहताब घटाए तारे नग में बिजली फूल और न जाने क्या क्या है उस दामन में वो
Correct.
दामन अगर हाथ में आए तो
Correct.
यस सर
So once the good breast is lost, then there is no interest left. ये दुनिया अगर मिल भी जाए तो क्या है?
या
The good breast is lost. Now what to do with the rest of the world? So the child feels that if the child attacks the bad breast in fantasy, brutality, sadism based upon constitution. Very soon the child realizes. In fact, before the child attacks, the child fantasizes. So the child wants the good breast, it is not there. So first thing it does is it fantasizes the good breast, and the lips start moving. You can see small children's lips are suckling even when there is no breast.
yes
So they fantasize the good breast. But that does not quench the hunger, does not quench the emotional needs also. So then the child gets angry because a desire is frustrated. He starts thinking what has happened and it concludes the good breast is no longer there, the bad breast has taken its place. Then it attacks the bad breast. After some time, it realizes despite using all its power, all its aggression, sadism, brutality, the bad breast has not accepted defeat and the good breast has not come in its place. So then the child feels powerless, that it has used all its power, but it could not make the bad breast go away or the good breast come. So the first sense of powerlessness comes. The first sense of I am not good enough comes. Then the sadness comes. Then the fear comes. Now the bad breast will attack me. It will do even worse to me than what I did to me. It will be even more sadistic and more brutal. And there is nobody to save me. So it's going to be what Schopenhauer says, endless pain to a painful end.
endless
So
pain to a painful end.
this is how he defines life.
Uh-huh.
He's a pessimistic thinker. So from his pessimistic standpoint, it defines life like this. Endless pain to a painful end. So the child is now terrified of it. And paranoid anxiety starts. A brutal attack is going to come, which will take me to this position of endless pain to a painful end. And then intense helplessness comes, that not only I cannot save myself, but nobody is here to save me. So maybe I am powerless, but somebody could save me who is powerful. He says there is nobody. So neither I am powerful enough to save myself, nor there is anybody else. It is going to be this endless pain to a painful end. And intense helplessness comes. Again, when the good breast comes, the child is ecstatic. He thanks his fortune that somehow tables have turned, times have changed. And again, I am back to heaven. Because he was in hell when he was with the bad breast and waiting the attack of the bad breast. Again, he is in heaven. So this experience is alternate. The child, when he has the good breast, mother is present, looking after him, giving him milk, emotions, everything, safety. He is ecstatic. He is dazzled by the splendor and ecstatic in feeling, completely safe and omnipotent. So he feels omnipotent, he feels ecstatic, he is dazzled by the splendor, he feels 100% safe, he feels complete in that oceanic feeling with the mother, only you and me and no one else. So he is in heaven. All there, all as it should be is. And when
symbiotic bliss.
Correct. It's a dyadic oceanic feeling. Just as Freud talks about primary narcissism, where the child himself feels oceanic. This is a dyadic, two people oceanic feeling. That both of them create a bubble, a world, and they are living inside only you and me and no one else. Bowlby also pointed out this feeling when often you see lovers sitting in a park and they are completely lost into one another and completely oblivious to the rest of the world. Only you and me and no one else. So Bowlby uses the term participation mystique to denote that particular state of two people, a state of dyadic oceanic experience. So alternately, he feels this. When he is with the good breast, he feels omnipotent, safe, self-sufficient in that dyadic oceanic feeling, ecstatic, happy, all safe, all thrilling, dazzled by the splendor. When he is with the bad breast, he feels aggression, anger, helplessness, anxiety, powerlessness. I am not good enough. Often a feeling of shame that how powerless I am. Often a feeling of guilt. I must have done something to deserve this. The good breast left me because I must have done something wrong. That's based upon the constitutional strength of superego. How much shame and guilt do you generate? So you have two alternative states, a state of ecstasy and a state of terror and helplessness and everything. It's like heaven and hell, a state of heaven and a state of hell. When you experience the loss of the good breast, you are in a state of hell. When you experience the gain of a good breast, you are in a state of manic pleasure, a completely bipolar state. And this is how Kleinians explain bipolarity, that the gain of an omnipotent good object throws you into mania, and being with an omnipotent bad object throws you into depression. So for them, the bipolarity is a game of loss and gain of the good object. You gain an all good object, you are manic. You lose the all good object, you are in depression. The lower cycle starts. So this keeps happening. And Klein says, this is a very schizoid experience, a very split experience, that you are in heaven and you are in hell. And both the states are kept apart. They don't come together. They are kept apart. They are alternating. This is activated, this is deactivated. Then this is activated, this is deactivated. So you are keeping the two states apart. It's a schizoid situation. Schizoid because you are keeping the two apart. You are not allowing them to integrate. So this is a schizoid situation. And this is a paranoid situation because whenever you are not with the good breast, you feel paranoid fear. So because in this state, the two are kept apart, it's a schizoid thing. and alternately you experience ecstasy and paranoia. The Klein has termed this position as the paranoid schizoid position. Paranoid because when the good breast is not present and bad breast is present, you experience paranoia of the attack of the bad breast, and you keep the two experiences separate, which is a schizoidal thing to do. In fact, to be more accurate, you should have called it the ecstatic paranoid schizoid position, because it misses the experience with the good breast.
Yes.
So you should actually be calling it an ecstatic paranoid schizoid position. And this situation of the two states being different is the situation of the split being open. That the split is open, you have two situations which are schizoid. You are not closing the split by integrating them. There is a split in the consciousness that alternately you experience all good and all bad. And Klein says this also creates a split in the ego, that you also think about yourself in that way, that there is a part of you all good and there is part of you all bad. You don't integrate the two and say, yes, these are my good parts, these are my bad parts, overall I am this. You exclusively focus attention, it's a selective attention, either on good part, and when that happens, the attention on bad part is deactivated. So it's selective attention on either of the extremes. And Klein says this is a split situation, that you are splitting a subject into two, just as you're splitting the experience into two. So the split outside also is a split inside, that the child's ego also divides the inside into two, the good and the not good, just as it divides the breast into two, the good and not good, because still the capacity to integrate is not there. So inwardly also same kind of thinking is proceeding, that whatever the evaluation apparatus has built up, when it evaluates the inside, again the same thing happens. It's a split situation. So Klein says the split is open, meaning the paranoid schizoid position is there. Now, very importantly, Klein calls this paranoid schizoid and depressive position as states, not as stages. Meaning, it is not like Freud's oral stage, it is 0 to 2 years, and once 2 years is passed, it is gone forever. It is done. This split can activate any time in life and can be closed any time in life. So it is not a stage that you surpass in terms of age. It is a state which can activate or deactivate based upon inner and outer stress. So this Klein calls as the split open situation, the paranoid schizoid position. Now this Klein says is from 0 to 3 months. 0 to 3 months is usually the paranoid schizoid position, and the split is completely open.
Is that what PSI mean? Or
Sorry?
is that what PS-I mean?
No, I'll just come to it in a moment. This is what
Okay.
PS means. PS is paranoid schizoid.
Okay.
So the split is open, and when the split is open, you go into extreme thinking. All good, all bad. All powerful, all powerless. 0 or 10, nothing in between. It also leads to catastrophic thinking because the bad breast can attack any time. So this is the Kleinian explanation for catastrophic thinking. Then the catastrophic thinking essentially is the fear of the attack of the bad breast because the split is open. Right? Freud will say the same thing in a different way, that because the Oedipus is unresolved, it is the fear of castration anxiety coming to any time which leads to catastrophic thinking. So like this is a concept in CBT, but in psychoanalysis, we find people explaining the cause of this concept. Alternate experience happens and there is no integration. One is living in fantasy because only in fantasy somebody can be 0 or 10. In reality, nobody can be 0 or 10. Most people will be in between in 4 to 7 range. So when we say somebody is 0 out of 10 or 10 out of 10, both are fantasy positions. The narcissistic person, he believes he is 10 out of 10, which is a fantasy position. And the dependent person believes is 0 out of 10, which is also a fantasy position. It is fantasy applied to self-esteem. Whereas in reality, everyone is between 4 to 7, with a few people in society going to 8 or 9. 80% of society will be 4 to 7. Only very few people will be exceptionally talented. They will be 8 out of 10 or 9 out of 10. Nobody can be 10 out of 10. Similarly, nobody is 0 out of 10. So if you draw a bell curve of reality, you will have 20% people between say 4 to 5, and then majority between 5 to 7, and another minority between 7 to 9. So Klein says this paranoid schizoid thinking, it goes on between 0 to 3 months. Freud will say, even if you apply this, Freud will say 1 to 3 months because he will keep 1 month or half a month for primary narcissism. Now, Klein does not believe in primary narcissism. She says right from birth, we are object relating persons. There's nothing like an object-free psyche. So she puts it as 0 to 3 months. So she says this paranoid schizoid position of alternating between heaven and hell goes on for 3 months. The split is open in the paranoid schizoid position, and alternately you experience ecstasy and terror. This is what many psychotics do. They alternately experience ecstasy and terror. You can see them occasionally very happy and most of the time terrified. Okay, now the attack will come. Now the attack will come. So Klein will say they are still with the paranoid schizoid position. The split is open and they are terrified of the attack of the bad breast, which can come anytime. And that is Kleinian explanation for the delusion of persecution. That the split is open and the bad breast attack can happen anytime. And if the child has attacked the bad breast in not a very torturous way, he might have killed the bad breast or made 2 or 3 pieces out of it, then he will still have delusion of persecution, which is that a person is going to kill him. But if in his aggression, which was very high, he blew it into pieces, into smithereens, small pieces of the bad breast, then he will have a bizarre delusion that I don't know, but a lot of things are coming to attack me. So how sadistic, aggressive, and brutal the attack on the bad breast was in fantasy, that will determine the nature of the persecution. Is it the persecution from a person or a group of persons? Is it persecution from 1 or 2 objects which cannot be defined? Or it is a bizarre persecution of millions of objects coming to get you? Klein says, after 3 months, the child starts developing the idea of object constancy. That even when the mother is not with me in the perceptual field, she still can exist somewhere and she always comes back. So the absence of the mother is no longer seen as eternal abandonment, nor is it seen as annihilation of the mother. The child slowly learns the concept of object constancy and absence. And therefore, the fear of abandonment goes away. And the child slowly realizes that it is the same mother, it is the same breast, which is alternately available and not available. It is one breast which is at times giving and at times withholding, at times present, at times absent, at times accepting and at times abandoning. To whom I mean everything at a point in time, and to whom I don't mean anything at a point in time. And therefore, the child realizes that I was doing wrong thinking. These are not two different breasts, but one breast which is alternately good and not good. So the child brings the two together and realizes they are actually one. It is like, to give another example, let us say a company making biscuits makes glucose biscuits and salty biscuits. And the glucose biscuits are good and the salty biscuits are not good. So when you eat glucose biscuits, you are praiseful for the company. And when you eat salty biscuits, you hate the company. But you don't know who the company is. You have still not seen the manufacturer printed on the label. But one day you read the manufacturer and you realize it's the same manufacturer. He makes good biscuits and he makes not good biscuits. So your idea that the manufacturer of glucose biscuits must be making all good biscuits and the maker of the salty biscuits is making all bad biscuits, it's wrong. It is the same company which has good, bad and ugly aspects to it. So then what happens is your image of the all good company goes and your image of the all bad company goes, and you try to bring it together and you say, this company at times makes good biscuits, at times does not make good biscuits. Similar thing happens in case of the breast, that you realize that the breast is neither all good nor all bad. It is one breast which is at times giving, at times withholding, at times accepting, at times abandoning, at times caring about me, at times not caring about me. So what this does is it brings together the two extremes and creates a realistic integrated whole picture. So from extreme thinking, you are moving into realistic integrated thinking, RIT. ET to RIT. And this position, when you do integrated realistic thinking, is called by Klein as the depressive position. And therefore, Klein says you have to move from PS to D. And this movement starts from 3 months, and by the time of 6 months, it's by and large done. So 3 to 6 months is the transition from PS to D, from paranoid schizoid position to a depressive position. And by 6 months of age, the child enters the depressive position. Now this has two aspects to it. One, now that he knows that the breast is neither ecstatic nor terrifying, both the extremes go. The ecstasy goes away. The dazzle of the splendor goes away. At the same time, the terror goes away. The powerlessness and the helplessness goes away. The shame and the guilt goes away. So there is a cost of overcoming that paranoia, that hell position. You are free from hell by paying the cost of heaven. The two go together. You cannot have heaven and not the hell. If you want to be free from the hell, you have to let go of the heaven also and come back on the planet Earth. So now in the depressive position, you are on the planet Earth. Neither all good nor all bad. So the terror is gone, but the ecstasy also is gone. And this, according to Klein, is the core developmental achievement for the mind. To be able to move from a paranoid schizoid position to a depressive position. And Klein says, this is a state, not a stage. It is not that once you move into a depressive position, you can never go back to a paranoid schizoid position. Adequate stress from inside or outside can always undo the gains of depression and throw you back into a paranoid schizoid position. And this is what happens in stress, that any stress undoes the depressive position and throws you again into a PS position. So the I that is here is that I always say that the depressive position also has been wrongly worded. It should actually be called realistic integrated position, RIP. So you're actually moving from a paranoid schizoid position to a realistic integrated position. That one, you are integrating, and second, you are realistic. So this is realistic integrated thinking, RIT, versus extreme thinking, ET. So the whole game is moving from ET to RIT, from extreme thinking to realistic integrated thinking. Now, in some cases, this does not happen. In majority cases, it happens. But in some cases, children are not able to move from paranoid schizoid position to a depressive position. They remain stuck in the paranoid schizoid position, and the split remains open partly or substantially or completely. So you can have mild, moderate, or severe fixation in the paranoid schizoid position. Mild will just make you a fearful person, extreme person, anxious person. Moderate will get you into a personality disorder, and severe will get you into a psychotic situation.
So nicely explained. Very nicely explained.
So what will prevent a child from moving from paranoid schizoid to depressive position? And there is a range of reasons for that. Reason number one, constitution. If constitutionally the child has very high aggression, very high sadism. I was going to speak sadness, my own slip coming out. If the child has very high aggression, very high sadism, very high domination, very high brutality, then the attacks on the bad breast will be so severe that the fear of attack of the bad breast back upon the person also will be very high. And the duration for which child had good breast experiences and the duration for which the child had bad breast experiences, in that thing, the bad breast experiences will be far more, either in duration or in intensity. And therefore, if the child tries to bring the two together, nothing good will be left. And we all need a good center inside of us around which all the good memories can be woven. We all need a good center inside of us. Otherwise, we will be constantly at the mercy of all the difficult feelings and thoughts. So in order to preserve whatever goodness we have, we keep the split open. We don't allow them to come together.
Sir, please repeat the last that you said. All of us need a good center.
A good area inside of us where all
Yes.
the good things are kept.
Uh-huh.
Now, if the brutality of the attack of the bad breast is very high,
Mm-hmm.
and that has created very difficult experiences inside of us, and we try to bring together the good and the bad, it is like bringing together -7 and +2. The net result will be -5. Nothing good will be left. So it is possible to go from paranoid schizoid to depressive position when you are trying to bring together +5 and -2. That the good breast experiences are more than the bad breast experiences. Because some of the good breast experiences are going to be neutralized in neutralizing the bad breast experiences. If constitutionally you have very high aggression or sadism, and therefore the bad breast experiences are very difficult, and when you try to bring them together with good breast experiences, the goodness is too less compared to the badness. The same situation you can reach from the mother's presence and absence. That if the mother was more absent and less present, the bad breast experiences are more and the good breast experiences are less. And one is addicted and one is desperately dependent on whatever little good experiences one had. And that one wants to preserve as it is. One doesn't want to use that currency in the currency market of bringing the two together. It is like, say, currency of one country, 2 rupees, and I have $5. And each dollar will be neutralized, will be used up to buy the other currency. So you have -5 and +7, you can still do it. But if you have -7 and +5, there's no way you can do it. Because then you will be left with no good object inside, and you will just have all the difficult experiences. So Klein says that if you had too much of difficult experiences and too little good experiences, in order to preserve whatever little good you have, you don't go fully into a depressive position. You can't give up the little good that you have. And therefore, the split remains open. You remain stuck in the paranoid schizoid position to some degree. Second reason is addiction of the good object. In some people, the ecstasy will be so addictive that one will not be able to give up that ecstasy. That if I allow depressive position to set in, I will lose the all good object and I will be left with a realistic object. I will lose the terrifying object also. But I have the choice between having ecstatic object and terrifying object, number one, or number two, not having either and having a realistic object. And I am so addicted to the ecstasy that I can't give it up. So to some extent, I keep the split open. Third reason is envy. If the envy is very high, then one attacks even the good object, not only the bad object, because one cannot endure goodness outside of oneself. One feels envious of the good object. The very good object I am dazzled of, I am ecstatic with, I also have envy towards the same object. It's ambivalence. I am in awe of the all good object. I am ecstatic with it. I want it and yet I am envious of it. And because of envy, I attack the good object also. And when I attack the good object out of envy, the good object is also destroyed like the bad object. And I have few good experiences left to internalize, because I am not able to internalize a good object, just as I am able to internalize a bad object. So envy will also keep the split open, fixated oneself in the paranoid schizoid position, because it will attack the good object and not allow internalization of the good object. I cannot endure that goodness other than me. How can I internalize it? If I can't endure it outside, how can I endure it inside? It will become even more problematic. So envy will keep it open. The third will be greed. Greed may make me have desires to go into the good breast, extract all the good things, bring it inside of me and hold. And then what is left outside is no longer a equally good object as before. And now when I internalize it, I internalize an impoverished object. An object which has already been plundered, looted. So my good object is actually a very feeble object, already a looted, plundered, half bankrupt object. And the bad experience is bad internalization as it is. Again, the split cannot be closed. Sorry?
Good about the way I introduced myself.
The
I'm
way?
sorry. I'm going back to the reverie. I come from rich contexts with tough conscience keepers, but little or no baggage, and with adequate ego strength. So it was a good explanation, actually.
Correct. Correct.
So I'm getting a positive experience, not ecstatic, but positive.
Correct.
Yeah,
So uh, the opposite of envy is gratitude.
absolutely. Absolutely. I see it.
And the opposite of greed is sharing and altruism.
Generosity and altruism.
Generosity.
Yes.
So,
Giving others what I could not get.
correct.
Yeah.
So, these also in the child, apart from constitution, absence of the mother, envy
Mm,
and greed also can throw spanner in the work.
mm.
The addiction to ecstasy may not also allow the split to close. Similarly, inability to go into depression, because when you give up the all good object, you undergo sadness. So in the transition from PS to D, every child has to undergo some depressive phase, the giving up of the all good object. And one may not have the capacity or the readiness to go into that depression. And therefore, the movement towards a realistic integrated position is avoided. One keeps oneself in that extreme position.
I have a couple of points to say.
Please, please.
Uh, I think we should go to the previous slide because we are discussing points on from this previous slide. Yeah. Envy, greed, omnipotence, internalization, and engulfment. Here it is a small typo.
Yeah,
And now on the next slide, uh, here that it may be just a nomenclature difference that I'm remembering, but 1980 Amhara textbook that mentioned object permanence in case of Piaget's biological structuralism of intelligence, cognitive development, and object constancy where uh, the frustrating object and the gratifying object are the same. And when the child realizes that, then there is integration.
correct.
That is what. So here we see, in dynamics we use object constancy, whereas in cognitive realms we used object permanence.
Correct.
That is what I remember.
And what
And
he is calling integration is what we call the movement from PS to D.
absolutely, this PS, sir, I am sorry, but in your slide we must have this the correct version that you said, like omnipotence paranoid schizoid position, not just paranoid schizoid,
Correct.
and realistic integrated
Thinking.
writing. Yeah. Because if I'm losing it now, during the lecture, I'm sure to lose it after. If I see this presentation a month later, I'm not going to remember. So this is fantastic. This is fantastic.
So many people will not be ready or have the capacity to undergo the depressive position
Yeah.
because of the depression that it brings, because of the loss of the omnipotent all good object.
Yeah.
Now, the evaluation of the psyche is different. Like one can say, if you are losing an omnipotent good object because of which you are feeling sad, then should it not be compensated by the loss of the terrifying object also? That you should be ecstatic that the terrifying object is lost. Somehow the psyche is not behaving that way. That we are not feeling the ecstasy of freedom from the terrifying object. We are only feeling relief, we are not feeling the ecstasy. Otherwise, this depression was not necessary. One could still simply go into another position which is less emotionally extreme. It's a more serene position. There was no need to be sad, because if you have lost something from on one hand, which is the good thing you have lost, you are also free from something terrifying.
Does that endorse the presence of Thanatos?
Yes.
Likely.
So somehow we don't appreciate the loss of pain as much we appreciate
Appreciate.
the loss of pleasure. So that remains an open question, but somehow Klein says that this is so, that we are not as ecstatic at being free from the bad object as we are sad in losing the good object, and therefore there is a depression which one has to undergo. The second element that Klein talks about is of guilt. That when the child realizes that he has attacked the bad object, actually he has attacked the good object thinking of it as the bad object, the guilt comes in, and out of the guilt the child goes into reparation. And in fantasy what he does is he tries to undo the attack on the breast. Whatever like pieces he has thrown out of the breast, he tries to reconnect it to the breast.
कोई लौटा दे मेरे बीते हुए दिन.
Correct, correct, exactly.
Hmm.
So this is the idea that early life world of how it is. And in the same early life world, we see fantasies. Fantasies like engulfment, that somebody will engulf me completely. Merging back, what if the baby is terrified? What if I go back into the stomach? Or the fantasies that there are other babies in the stomach. And the child is greedy for the mother, and for the fantasy is I will go into the stomach and kill all those babies. Or the,
Solid.
the
Image.
fantasy is that maybe the mother, when she is seen as the bad mother, is a baby eating mother. Maybe there are other babies like me and she has eaten up everybody and my turn may come. So These are all good mother, all bad mother fantasies. The engulfment, the merging, the fusion, being devoured, having competition inside which one wants to kill. So these are all the early life fantasies. Defensive operations in the inner world are always there. And therefore, it's difficult in the Kleinian world to accept Freud's idea of when the ego separates from the id.
Sir, please say again, sir.
Defensive operations in the inner world of Klein are always on. And therefore, it's difficult to accept the Freudian idea of ego emerging out of the id in the Kleinian context. It seems Klein's ego is far more early or maybe even inborn, almost inborn kind of an ego, if not a complete ego, at least a proto-ego. You can at least call it a systems ego. It may not be coordinating between the inner world and outer world, but definitely it coordinates in the inner world. So you may not call it a full ego, you may call it a systems ego, a proto-ego. The omnipotence is very important. That why do we think of the good object as all good and the bad object as all bad? Why can't we think of good object as a mild good object and a bad object as a mild bad object to start with? And that is where the idea of omnipotence comes. That somehow the human mind is loaded with this surge of omnipotence and the belief in omnipotence.
Omnipotence and
Belief in search and belief of omnipotence. Search of and belief in omnipotence. Otherwise, it could have been very easily possible that we think of the good breast as mildly good and bad object as mildly bad. But our search of ecstasy and our sadism is so high that we invest what is inside onto these objects. So constitutionally, the search for omnipotence and our aggression is so high that we deposit them separately. So the
since birth.
sorry,
Otherwise, a person would have been emotionally mature since birth.
correct,
Mild good, mild bad.
correct. So we start with high intensity, unattenuated affect. So the pristine primordial affect is very unattenuated, very intense. And that is separated into two, the all good and all bad. So there is omnipotence on one side and good omnipotence on one side and bad omnipotence on the other. So the good breast is omnipotent good breast and the bad breast is omnipotent bad breast. And we are helpless against both of them. We can't manufacture our own good breast and we cannot stop the bad breast. So the idealization, de-idealization is always on, even from birth. And that has to do with our search for omnipotence. That by birth, we are programmed to search for omnipotence, to enjoy omnipotence, to believe in omnipotence. And therefore, for Klein, what is very central to our health is internalization of a good, reliable, stable object. Klein says, we keep internalizing what we see. If you see a happy, vivacious mother, you will internalize a happy, vivacious object. If you see a sad mother, you internalize a sad mother. If you see a dead mother, you internalize a dead mother. If you see no mother, you internalize emptiness. And in the adult situation, then you don't know why I am feeling so empty. One of the core features in borderline, the emptiness. That I'm surrounded by people, everyone good, but I don't know why this emptiness is there. And many times I try to fill up that emptiness by overeating. I don't need nourishment, vitamin, nothing. I just am trying to manage my emptiness. Soren Kierkegaard, one of the Danish philosophers, he used to experience this. He was a very rich man. So, and he was all alone. Parents had passed away. He had not married, not living with brother, sister, anybody. He was living alone. So he had a huge house and he used to arrange elaborate dinners only for himself.
Wow.
And he used to say, emptiness is the heart of grandeur.
क्या बात है?
That he is living in a grand house, arranging grand dinners, but inside he is completely empty. So he used to say, emptiness is the heart of grandeur. Because you are empty inside, you build huge, grandiose, grand things outside.
He had insight.
Huh? Ah,
He has dazzling insight.
correct.
And honesty and courage to acknowledge it, express it. Amazing.
There's another good statement of his which I often recollect.
Uh-huh.
His critics used to pass very difficult judgments on him. And his work was not getting the due credit. So he was asked once, how do you feel not being respected by your professional community? And he said, nothing can be more humiliating than to be respected by them.
He could manage to static position also.
This is something like one of the statements one can frame and keep in the room.
Yeah,
Nothing can be more humiliating than to be respected by them.
Iti-chan. Very nice.
So,
What are you running after?
correct. So,
Mm,
internalization to Klein is central.
mm.
Klein goes to the extent of saying it is not only central for psychic health but also biological health in the formation of immune system. That internalization of a good, reliable, stable object is at the core of psychic health. And often we see in cross therapy studies, there have been many cross therapy studies for decades now. Okay, which therapy is better than other therapies?
Fair
And people
point.
have, yeah, and people have done across therapy studies. People have done different therapies for the same disorder. Okay, for a given disorder, which therapy is better, or in general, which therapy is better, and always the same conclusion is there. It is not the therapist, it is not the therapy, it is a therapist that matters. And one explanation of that is that apart from everything else that is happening in therapy, based upon what technique you use, one thing which is common is internalization of a good, reliable, stable object.
Exactly. Point out to somebody that whichever school you follow, I am convinced that patients get better just because of love.
So the moment the therapy space is safe and you
Mm,
go there consistently, and
mm,
the person is ready to accept you amorally,
mm,
you start internalizing him as a good, reliable, stable object.
mm.
And this fulfills the early life deficit, regardless of what technique he is following. And therefore, if you cannot do anything else, just be a safe object. And this will happen. And this, the good part of it is, you don't have to know this for this to happen. A person who has never heard of this statement, he may be very good in facilitating this. So there are many people who are naturally good therapists because they give the feel of something safe, and people are who want to internalize can internalize them very easily. Neither of them will know the concept of internalization, but the process will happen.
Exactly.
So,
Not even the doctor and the patient understand what transpires between the two. Yes, sir.
so in any human encounter, so many things happen unconsciously, we don't even know what's happening.
Mm.
We know only the surface. Rest of the system is completely unconscious in the transaction. So
But
that is
if we
true
say
for.
sorry,
Please go
if
on.
we if we say something sacred that transpires between the two, people will immediately say this is not right. You are being judgmental.
Uh,
It is sacred actually.
yeah, safely what we can say is if the unconscious transactions are far higher than the conscious transaction. Now,
True.
whether the unconscious transactions are salutary or traumatic is a different thing. In most cases, they will be salutary, and in
Mm.
some cases, they will be traumatic. So, uh, the omnipotence part is very important, and the internalization part is very important. We internalize whatever is in front of us.
Mm.
So, a good mother, a bad mother, a cold mother, a giving mother, a withholding mother, an absent mother, or complete emptiness. And based upon what we have internalized, if it is difficult, if it is good, it becomes a source of aliveness, strength, happiness, enterprise, confidence, and a healthy way of seeking out human relationships and being there. But if what we have internalized is difficult, we have internalized absence of the mother, we have internalized attack of the mother, the coldness, the sadness, the deadness, or the emptiness, then corresponding to what we have internalized, the pathology flavor will come. Emptiness will generally lead to borderline or eating difficulties. Sadness will lead to depression, or if it is intense sadness, to bipolarity. Deadness inevitably will lead to bipolarity or histrionicity. And present and withholding will generally lead to greed in some corner of the life.
Or envy.
Sorry?
Or envy.
Yes.
Mhm.
Envy will lead to attack on linking, the formal thought disorder. This is Bion's idea that what happens is that the thought brings messages from the outside world, how good or not good something is in the outside world. If the envy is very high, we can't bear to see anything good outside of us. Now we want to destroy it, but in reality, it's not possible. So we cannot destroy the object of envy. So we destroy the messenger who brings us the message that something good is outside of us. And that is where envy attacks the thoughts which bring the message. And thoughts are a process of linkage. One thought is linked to another thought. And this linkage is attacked by envy. And therefore, excessive envy leads to formal thought disorder. I have sorry, I have discovered narcissistic rage also can do the same thing. That if I want to be on top of the world and I have to be at the bottom, there is no way out. Then there is a rage at the world because the world is not my world. And there's nothing that can be done about the world. So the rage has to go at the messenger because it's unbearable to receive these messages every day that somebody else is at the top and I am at the bottom. So it can also be that power narcissistic dynamic which can lead to formal thought disorder. Should we break for a cup of tea?
As you say, sir, I will be happy. I have a couple of comments that were left. Is state versus state and not a stage. That is also applicable to theories by Harry Stack Sullivan and Erik Erikson. Their theories also say that they are not concrete watertight stages, but states. But I'm not very confident with what I'm reporting.
Uh,
Harry Stack Sullivan said syntaxic, prototaxic, pentaxic, syntaxic modes of thinking or
uh,
relating.
Sullivan, I have not read much, but Erickson, I can say something. Uh, to have a stage-based theory and to say that somebody has a delayed stage setting, or somebody has skipped a stage, or somebody is fixated in a stage,
Hmm.
is very different from not having a stage-based theory.
Hmm.
Like for Erickson, it's a stage-based theory. Now, you have to move across stages. Let's say you are fixated in a stage. You cannot move ahead.
But he says if you get fixed, if you get stuck, then that creates an opportunity to reopen the prior stage and go back there and resolve it.
Correct. But the differentiating factor is it is age-based. That in
Mhm.
this particular age group, this is the thrust of the psyche. So that is a stage-based, like Freud, 0 to 2 oral stage, 2 to 3.5 anal stage, 2 to 4 maybe anal stage, 4 to 7 or 4 to 5 Oedipal stage. So when you have a chronological age which says that this age, this is the central point of the psyche, it is stage based. Once the stage is over, you are done. Let's say one is not pathological, one is normal. Then you move from one stage to the other. Oral stage is over, you move into anal stage, it's done. The oral stage is never going to come back. But in Klein, huh?
But when you get stuck
Huh,
and repression doesn't help, you regress and you regress to earlier stage.
correct,
So then again you are getting the opportunity to or not utilizing the opportunity to resolve the stage where you got stuck.
correct. So what
Mhm.
happens is in normal circumstances, if someone is not pathological, the
Mhm.
stage once it is over will never come back.
Okay.
But in Klein, even in case of a normal person, if he
Mhm.
loses 20 lakh rupees on the stock market, he may not
Mhm.
have any pathology of DSM. He will still go into paranoid schizoid situation.
Mhm.
Right? Let us say
Yes.
India-Pakistan war happens and large section of India goes into paranoid schizoid position.
Mhm.
Now, many of them will not have any DSM problem and yet it will reopen
Mhm.
because this is lifelong thing. Anytime it can reopen, anytime it can close.
Mhm.
So for normal people also it is lifelong, and for those who are fixated, of course, it has never closed. So for those who are fixated, even the stage-based theories, the fixated stages become permanent, and even the state-based theories, the states become permanent. In a
Yes.
in a generic way, one can say whether one is fixated, whether you look at fixation as stage-based or state-based, the moment the pathological fixation happens, if it is chronic, it is then forever till you heal it. So even if the age is supposed to close at a particular time, it is not closing. Even if a state is supposed to close at a particular time, it's not closing. So it endures. Any fixation endures far beyond its normal situation. But for a normal person, Erickson's theory is a stage-based theory. Freud's theory is a stage-based theory. But Klein is a state-based. In fact, even Jung's theory in one sense is a stage-based theory. Because Jung also talks about the program of life, just as Erickson talks about a program of life. Both Erickson and Jung are based upon program of life idea. Just that they see the program differently. The specifics of the program are different. But the fact that life is an orderly flow of events which is biologically rooted is common to that we all will have childhood, we all will have parents, we all will separate from the parents, we all will have teenage, we all will have young adulthood, mature age, old age, and death. So this is a program of life approach. Now, whether you divide it into 0 to 5, 0 to 7, those slices will be different. Like Jung does not go into the chronological slicing of the program of life like Erikson, but he goes qualitative slicing. So he will say the child archetype and the mother and father archetype will be activated till the child is a child. And the moment he gets into a teenage, the child archetype will deactivate, the parental archetypes will deactivate, and the prince archetype will activate. He now has to separate from the parents, go out into the world, and seek out his identity. And through struggle, he will go through and at last return with a princess. The core of mythological stories, which Jung says are only expressing what is happening deep inside. And these stories are universal, found in every culture. And Jung says that cannot be because of cultural diffusion. It is because of the apparatus inside, which he calls the collective unconscious. That it's a species constant across the species. Nothing to do with whether one is in USA or India, in the city or in the tribe. It is species constant. Like just as the entire species stands on two legs, the entire species has the same embryogenesis. Similarly, the entire species also has the same program of life. And similarly, the entire species across history, by and large, creates the same stories wherever they are. So, this is how we look at the stage-based and the state-based.
Yes, sir. Thank you.
So, it's very interesting to see Bowlby's idea of attachment and Klein's idea of internalization. Probably, attachment is more fundamental. That we get attached to whatever is in front of us. And some of that, or large part of that, if we are attached strongly enough, we internalize, because then the mourning of separating from that is very difficult. That if we get attached to objects around us, then we don't want to separate from them. Because once you are attached and you have to separate, this sadness. And one way to avoid that sadness is to internalize it, so we are never separate.
What is the difference between internalization and engulfment in that sense?
Engulfment is not like I will be swallowed by somebody.
Mhm.
That is a fantasy that I have, that some object is so large and devouring, it will completely swallow me. The psychotic fantasy. But internalization is that I am surrounded by objects, some of which I am attached to, I am interested in. So first is I recognize them as existing. Second, I am interested in them in something. Third, I am attached to them. And then fourth, I internalize them. And after the internalization, they remain inside of. What happens is, for example, it takes care of reoccurring abandonment. For example, in the early life, when the mother leaves, the child feels she's gone forever. But once he understands the object constancy, he realizes she's somewhere, and then internalization happens. So after internalization, even when he goes out for 3 months, she is inside of. Now, if the internalization is not strong enough, then it fades away very rapidly. It has a very small shelf life. So internalization is not equally powerful in everyone. For example, let me give 2 examples. In a dependent personality, if you meet someone, let us say you are very lonely and you don't feel good. So in a dependent personality, loneliness will always bring about anxiety, sadness, and emptiness, listlessness, no energy, no motivation. All the depressive features will be there. The moment somebody comes in to meet you, suddenly you feel happy. Suddenly the energy, the positivity, the interest, initiative comes. And let us say he goes, and after he goes back, for at least 5 to 6 hours, that experience continues. You don't feel lonely for the next 5 to 6 hours. That's the shelf life of that internalization. It's a very temporary internalization that even after he goes, he is with you for some time. But after some time, again, the loneliness comes. Now, take another example of sadhus who live in Himalayas. Most of them live in the ashrams at the foothills of Himalayas. Very few of them go up and live in a cave. And one of the final examinations of most spiritual schools is this, that after you have completed the sadhana, you will be left alone in a cave for 21 days. Food will be provided to you. Somebody will come and keep it and go out without talking to you. When the door is closed, he will put the food and go out. And after 21 days, your teacher will come, your guru will come and examine you. Are you still healthy, happy, strong, resilient, or are you broken? And this is a test of internalization. That if you have internalized well, good, reliable, stable object, only then you can live in those caves for 21 days without any. Because they are there inside of you. So you are not lonely because you are surrounded by your people inside of. And the highest internalization is of that supreme power who you feel is inside of. And then the galaxy of people also are not required inside of. That's the final internalization. That you internalize the real, omnipotent, good, reliable, stable object, which is God in some form or the other. Very few people can do it in a formless internalization. Most people will have a form. And that's where the idol worship happens. Helps. That you can internalize a good, reliable, stable object with form. It's much easier.
In Vipassana, they don't allow you, they don't advise you to visualize any idol or any mantra also.
That's a different path of the Buddhist path of awareness, which is very different from the tantric path or the classical Vedic path, which is idol oriented. But for most people, the idol oriented path is much better. And the techniques of the other path can be used without that particular thing. Or when you are doing those techniques, you can follow them completely. But not every day. Like you go for Vipassana once a year, you follow exactly what they say for 10 days. But rest of the days, you don't have to follow that philosophy. Now, why the split? In a way, because we are just beginning to think. we are, so to say, cranking up our mind to get into activity. And we don't even know language, we don't even know names. So we are distressed. We go to the mother, we just cry and throw our hands and legs, and the mother gives us the name that you are hungry. We only know distress, we don't know the word hunger. Whenever we are hungry, we are in distress, we cry, we throw our hands and legs, our body if we can. We only know distress, which is inane, which is chaotic, which is anarchic. And it's almost like an infinity is open in front of us. We don't know what's happening to us. We don't know if we will survive or not. It is the mother who gives it a name, calls it hunger, and tells us that it's nothing to afraid of. It comes and goes. So it is the name which closes the infinity. And when we start thinking, we can't think of 100 names on a continuum. We can think only on the ends of the continuum. And that is how the split thinking starts. That we are cranking up our mind to think. And the first step out of fantasy is split thinking. That before split thinking is primordial fantasy. After primordial fantasy, we get a name from the mother of the infinity. It closes the infinity. So we get the first name, and the first psychic operation that the mind does is to think of the opposite and create the second end of the continuum. That mother gives the name hunger, and we come to conclude, yes, there's something like no hunger. So the split thinking actually is the beginning of thinking that initially there is only primordial fantasy. And then same thinking starts with the mother giving name to an open infinity. And the name closes the infinity, and we know this phenomena is called this. This is the one end of the spectrum split defined by the mother. And then our mind thinks of its opposite and thinks of the other end of the spectrum. It is the first cognitive leap we have taken. And to think of all the sophisticated hybrids in between will come much later in the depressive position. So it's an epistemological, it's an entry into the epistemological world. And it is a gain, a cognitive gain, a developmental gain of that time, that we are able to think in terms of the split. Because before this is just a name without a continuum, and before that is just primordial fantasy. So it is an entry into the epistemological world, and no wonder the entry is crude compared to the sophisticated thinking later on. This also is, in a way, an organic thing to happen, because in the world that we live, everything is on a dual continuum. Think of anything and you can think of its opposite, and all the in-between hybrids. War and peace and all the in-betweens. White and black and all the in-betweens. Sweet and bitter and all the in-betweens. So the reality the human mind encounters, we don't know exactly what the reality is, but as we encounter it, we definitely know it's a reality of duality. The reality that we can know is the reality of duality. And no wonder that our minds, which have grown amidst this, is thinking of the split as it enters the epistemological world. Philosophically, we can say, we first think of simples and then compounds. That first we think of simple objects and then compound objects. For example, take the example of colors. If we say there are three primary colors and all other colors are made out of three primary colors. So the three primary colors are the simples and all other colors are the compounds, logically speaking. So we start with the simples and then move to the compounds. Similarly, we start with the split and then move to the more sophisticated combinations of ideas. So we think of the concrete before we think of the abstract. We think of the extremes before we can think of the in-betweens. So this is how the split is not something to be looked down upon, but to be seen as a natural developmental movement where we move from no thinking and primordial fantasy to a name given by the mother which defines one end of the split, to the split thinking, to the realistic integrated thinking. So the split is not to be condemned as a unvarnished pathology. Rather, it has to be seen as a developmental process. And the second part is as epistemological inevitability. And second part is it is also necessary. Why it is necessary? I'll come to it in a moment. Before that, I would like to state that there is a split regarding the split. That most Kleinian thinkers believe and most psychoanalytic thinkers believe there can be nothing good about the split position and nothing bad about the depressive position. Just as in the split position we have heaven and hell, now we have paranoid schizoid position is all bad and depressive position is all good. We have split thinking about this, which is not true. As we will see when we go deeper, we realize there are some good things about the paranoid schizoid position and not good things about the depressive position. So in general, it is true that split open is seen in pathology and split closed leads to health. Completely agreed, no point. But that is not the whole truth, it's a part truth. Two-third truth, no doubt, but not the full truth. So two-third truth, it is true that the split is problematic and depressive position is salutary. But another 20% exceptions are there where there are good things in the split and not so good things in the depressive position. So let us look at them, the exceptions. Some people have a problem that the split never opened up. So what we want is the split is open and it's closed. The paranoid schizoid position starts and the depressive position, it ends the split. But in some people, the split just does not open up. They just don't have enough of the paranoid schizoid position. So what is the outcome? They are perpetually confused. They can't separate the good from the bad because the split never opened up. It's like this. The good and bad are too near to each other. The white and the black are too near to each other. The enemy and the friend are too near to each other. So the split has to adequately open. One should understand extreme points of the split and then it has to close. If it just does not open up or prematurely closes, the man is confused. So whenever we see in DSM confusion as a criteria, we come to the psychoanalytic interpretation that the split never adequately opened up or prematurely closed. The second problem is the split opening and closing too fast. That leads to perplexity. That man thinks something is good and next time he thinks it's bad. Again thinks it's good, again thinks it's bad. The split opening and closing too rapidly. It's perplexity. So refusal to split is a problem. Inadequately remaining open is a problem. And opening and closing too fast is a problem. If the split has just not opened up, the man cannot even judge. He finds great difficulty judging anything. If it's inadequately opened or closed very fast, very prematurely, the man is confused. He can't separate the good from the bad. And if it's opening and closing too fast, it's perplexity. Now you think this thing is good. After 5 minutes, you think, no, this is bad. After 5 minutes, again, you think, no, it is good. So these are split issues that in general, opening and closing are related with, opening is related to pathology and closing with health. but there are exceptions. And the opening also is necessary before the closing happens. No opening is a great impairment of judgment. Inadequate opening or premature closing is confusion. And too rapid opening and closing is perplexity.
So what was the first one? No opening is?
The opening just is negligible. You can't just judge anything.
That indicates?
Uh,
No, you said something. I just wish that you repeat what you said.
the man finds it difficult to judge anything. It's a severe impairment of judgment.
Severe impairment of judgment.
He just gets paralyzed to judge, which is different from the anxiety of the dependent. The judgment impairment in dependence is out of I am not good enough and anxiety. This judgment impairment is out of inability to make out the positive as positive and negative as negative.
Inner impoverishment. Though its inner world is not populated enough.
Correct. And that probably will see in extreme mental retardation. Now, the split is also related to other phenomena. That one can experience loss of the mother in the paranoid schizoid situation, or during the depressive phase, or after the depressive phase. When the loss happens is very important. Like loss can happen at any time in life. Similarly, attack. When does the attack happen? Because loss and attack are fundamental to pathology. In most chronic pathology, we will always see the split, open, loss and attack playing out in some way or the other. Take up any personality disorder and you will see split, open to some extent. You will see the phenomena of loss and the phenomena of attack. So, split, so loss, if it happens when the paranoid schizoid position is open or is going on, is the most terrifying form of loss, early loss. First 3 months. Loss happening between 3 to 6 months while the depressive position is getting consolidated, second degree of loss. After the depressive position, third degree of loss. After 1.5 years, fourth degree. They are very different outcomes. All of them are losses, but they are very different outcomes in pathology. Earlier the loss, the severe is the pathology. And as we said before, what happens before the loss and after the loss is also important. Let us say the child has very good experiences with the mother for the first 3 months. And the mother then starts working in her office. So the loss is happening at 3 months of age, but before the loss, good experiences were aplenty. So that will create a severe personality disorder and probably somatization, but not psychosis. I am presuming that the person does not have a severely psychotic character structure. If he has a severely psychotic character structure and this happens, he can still end up in psychosis. But if the loss happens after the depressive position has been accomplished, the loss outcome is much less severe. And if it happens after 1.5 years, which Klein says is the Oedipal phase for Klein, it is even less. Similarly, attack. when does attack happen, and what happens before the attack and after the attack. And these two are very primary, loss and attack. If you do therapy long enough, you'll always realize in any chronic pathology, loss and attack always make an appearance. That the man at deeper parts of his psyche is definitely in the clutch, in the strange hold of some sort of loss or attack. And worse is if it is both. That the man has experienced loss many times and also experienced attack many times. So both the sources of anxiety are now active. Anxiety of loss and anxiety of attack. And the man may be pleasing everybody out of both to avoid attack and to avoid loss. And both of them, in the end, will not allow the man to be himself. Because his entire mind is like a radar. He is seeking out where from in the environment he is going to get an attack or loss. And half of the brain power is invested there. So he is neither at peace nor he is able to be as productive as he can be if this radar is switched off. But the radar is not switched off because of constant fear of attack or loss. And one of the goals of psychotherapy has to be to switch off this radar. So the man can be himself and at peace. Philosophically, if you look at the split, you can say that the mind is preparing itself to engage with reality, which is dualistic in nature, and where all systems function on some sort of stable equilibrium. And equilibrium is also of two contesting forces, not of a single self-regulating force. So in a way, the mind is preparing to enter this reality. It's a reality which is dialectic in its nature. And the mind also functions dialectically. I don't agree with that part, but people say it. I don't feel reality is really dialectic, but the mind is definitely dialectic. If you don't account for intuition, altered states of consciousness, creativity, if you look at the ordinary functioning of mind, it's dialectic. Whole mind is not dialectic. Some people will say the karma and the self journey are the ones which dictate whether the split will be open or closed. And then we always have this question that this is a fact of the human psyche for so many years, centuries. There must be some evolutionary contribution it is making. That it cannot be a unqualified evil. If it has survived evolution, it must be contributing in some way to survival, progress, or evolution in some way or the other. So
What will have survived? If survived, will contribute something?
The phenomena of split.
Split.
That why should we go into a paranoid schizoid position? It must have some evolutionary meaning. Otherwise, why is it repeating for millions of years? That the evolutionary meaning can be that it's preparing us to enter into a reality which is based upon duality, and where every system is based upon stable equilibrium brought about by two contesting forces. This is the fundamental nature of reality into which we have to enter and function. And the split and then moving into depressive position is a sort of training for entering that reality. And that is the reason the mind has adopted this way of developing itself and no other. because it's preparing to enter into a reality of the same kind. So it is from the nature of reality that in evolution, the human mind has decided or found it more productive to have this kind of a early life developmental process. That this developmental process is neither an accident nor falling from heaven. It has been deduced by the evolutionary force by looking at the nature of reality and out of the experience of the species. So that's a philosophical explanation of the split. Any questions you have?
So no, I think you are not well. You need to have water or tea or coffee, something again. You had some grunting and
Yes.
yeah. So I am concerned.
No,
We
no, it's
can
okay.
stop any moment.
No, 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 I'm perfectly okay. I'm perfectly okay.
Okay, okay, okay.
Any questions
I
you have?
I had this thing again. Split and addiction to ecstasy. The previous slide.
Yes.
Addiction. There is that C is missing. Addiction of ecstasy.
Correct, correct. Addiction.
Yeah, yeah, yeah. Addition
So,
of ecstasy. I thought it was. I mean, I did not know. Therefore, I haven't done my reading before.
hey, good you pointed out. I forgot to
Uh-huh,
mention a good important point today.
uh-huh,
Uh, as I said, we are looking at the good parts of the split.
uh,
And one we said it's a necessity, epistemological necessity,
yes.
to avoid confusion, to avoid perplexity, and to tune our mind to think and enter reality, the kind of reality we are going to enter. Now, another good part. If the split is mildly open, it can lead to huge amount of energy and creativity. So often, many people say that you need planning of the depressive position and the execution of the split position, because then you have that psychotic certainty and the psychotic energy.
You have the psychotic,
Psychotic certainty and the psychotic energy.
psychotic first part,
Psychotic certainty and psychotic energy.
certain, and psychotic energy. Yeah, yeah. In on the blurb of one book, and they have written it is an inspired lunacy.
Correct. Very good phrase.
Hitchhiker's Guide to Galaxy. That was the book. Science fiction. This.
Carl Jung used to say,
Uh-huh.
to be normal is the
Uh-huh.
ideal aim of the unsuccessful.
Idealism of the unsuccessful. Must have. Mm.
So he would say, like many people say, it's normal not to be normal.
Yeah.
So similarly, one can also criticize the depressive position by saying, okay, the depressive position is a very average position, a realistic position, but an ordinary position. Nothing extraordinary can be done out of there, because what you have there are incremental improvements, steady and sure, well planned and safe, but incremental. To do anything out of this world, you need the split open. To
Only
have
mad people have done something great.
So if you want to be Van Gogh, you need a split open. You can't be in a depressive position, healthy position, and produce what Van Gogh produced. To be a Salvador Dali, you have to be in the split open position. If you look at all the great movements in the world, many of them are outcomes of the split open. All ideologies are essentially work of split open, because all ideologies in some way are seeking omnipotence and to bring heaven on earth. In analytic terms, they are trying to regain their lost good breast. So the split can lead to many things positive. And the depressive position can lead to something very average, very conforming to society. Lot of reality acceptance, but nothing outstanding. It is slow and steady incremental progress. It is like the ordinary run of life.
Well, it is mediocrity. Statistical now.
So those are the things where the depressive position is not all good and the split position is not all bad. But on an average, when we talk of pathology, it is true that usually the goal should be to close the split and move to the
Yes. Yes.
so
But
because
let us stop splitting the split.
right. So there is a lecture of mine on my YouTube channel, Split
Yes.
in Confusion.
Split in the
Split in
kind of
Confusion.
fusion.
This talks of the same thing, that
Yes.
the paranoid schizoid position is not all bad, depressive position is not all good. But in general, when we talk of pathology, it is true that the split is generally a problem and the depressive position is generally a solution.
Yes, sir.
Should we stop for the day?
Great. Thank you, sir.
Thank you.